So the question I have for you is this. Is medicine working for you? Is it working for you? I'm going to tell you my feeling about this is that if it was working, half of you wouldn't be here. My goal is for people to move away from surgery if it's not needed and try to do something like stem cells if they are a candidate for it. Not everybody is. Okay. But we've seen things. Before I get into explain to you the different type of stem cells there are, let me explain to you a little bit about some of the things people have done, like cortisone or pain pills. 3 years ago, in Consumer Reports, it said here, the number one cause of liver damage in this country is what? Anybody take a guess? Acetaminophen. Tylenol. It's the number one cause of liver damage. It's not Tito's. It's not vodka. It's not Sambuca. It's none of it. It's liver damage. It comes from acetaminophen. Okay. We see today that the average adult is taking 3 to 4 different medications. The average adult elderly person is taking 6 to 8 medications. We have more hospitals, more technology than any other country. We have a Rite Aid, a CVS, a Walgreens on every corner, and we still have more people that are sicker than ever before. Before I get into cortisone, which I know a couple people have had, let me explain to you that the people here today are here because their doctor diagnosed them with arthritis. Correct? Okay. Let me explain to you that arthritis is not part of the normal aging process. Has your doctor told you it's just a part of your age? Have you ever heard that? One of the questions I usually ask a patient is, if you have arthritis in one knee and no arthritis in the other knee, how old is the good knee? It's the same age. So if a patient goes, oh, it must be my age, I go, no, Mary, your other knee's the same age.
One knee is older than the other.
So arthritis, number one, is not part of the normal aging process. It's also affecting our infants and our children. The kids who are on average with a phone 30 hours per month. They're using book bags and heavy book bags like this. Years ago, the number one joint for arthritis was the wrist for computers. Now the number one joint for arthritis is not knees, but it's the thumbs from texting. Has your doctor ever told you that arthritis, besides is part of the normal aging process, that it's something that goes away? Arthritis does not go away on its own. Arthritis does not self-correct. It is pathologically progressive, aggressive, and active, and keeps on getting worse. Okay? So what is arthritis? We're talking about degenerative arthritis. Arthritis is a condition that happens in a joint that's been overloaded, damaged, or irritated over time. After taking over-the-counter or prescription medications, people turn to other things and stronger medications that doctors have prescribed, which has now turned into our opioid epidemic. 80% of the people that are addicted to heroin were in some type of what? Opioid. It is no longer the bum down the street, the drug addict down the street. The people addicted to heroin are people like your doctors, lawyers, teachers, family members, people living on your street. It's an epidemic everywhere. After the opioids, a lot of doctors turn to something called cortisone. Just with a show of hands, how many people have had cortisone injections?
I did that.
Okay. If you don't ever learn anything else from me again, and you never want to come to the office I work in, again, that's your choice. Please do not ever take another cortisone injection again in your life. Can I explain why?
Yes.
Number one, for your joint to live, it needs a blood supply. It needs blood for your joint to live. when we inject cortisone, the number one side effect of cortisone is that it is blood thirsty. It eats away the blood. When you eat away a blood in a joint, guess what that causes? Arthritis. So yes, cortisone injections are supposed to decrease pain, swelling, and inflammation, but the long-term effects is that it causes more arthritis. It causes more of the condition that you're originally coming in there with. So why do doctors give it? They're trying to make you feel better, and it's in the way they are trained. It's what they know. Here's the other bad side effects of cortisone. If you have high blood sugar, it raises your blood sugar. It increases your chances of cataracts. It weakens your immune system. And if you're a woman, it increases your chances of something called osteopenia, which leads to something called You get a high five.
Because I got it, so that's why I know.
Okay, so now you know you're never going to get a cortisone injection.
I never had a cortisone.
Good. By the way, anybody hear this magazine, AARP?
Yes, we
Okay, Medicare. Guess how many cortisone injections Medicare allows you to have per year?
3.
What'd you say?
3.
You get 2 high fives. You're killing it. 3. Medicare allows you to only have 3 cortisone injections per year. Why? Because they know the detrimental effects, and it's cumulative in your body, and then it further leads to more degeneration, which then gives you a higher chance of going under a knife, on that cold metal table for surgery. And they don't like that because it costs them more money for surgery. So, here's the definition of degeneration. It's a joint that progressively deteriorates over time. Okay. So let me show you how to read an x-ray. And let me start off by saying this. I'm going to show you an x-ray on a hip, a disc, and a knee. Here's what I want you to learn. Well, my goal is for you to leave here learning how to read an x-ray. Here is a person who we cannot help. We cannot help a person if the joint is completely closed. Now, if a joint is completely bone on bone, we can't help that person. But I will tell you this. The majority of people that bring me their x-ray, and they've gone to their doctor, and their doctor tells them it's bone on bone, the majority of the time I can tell you, you might see a piece of the joint that is bone on bone. That doesn't mean the whole entire joint is bone on bone. If there is some space in a joint, if there is any space in a joint, that joint can be regenerated, rebuilt, and it can repair itself. And can probably, with stem cells, taken back one stage previous. See, stem cells, I said, just doesn't mask the symptom, it fixes the problem. And there's a difference. As I tell everybody this, if there is something you could do, anything you could do, besides getting surgery, wouldn't you try it? Yes. Because once they cut the body part off, it's gone. Here's an example of a knee. This is actually a picture of a right knee. But I want you to understand this because I'm going to show you the same thing with a hip and a disc. This bone up here is called your femur bone. It articulates, it meets your shin bone called here. Can you see the bottom of this bone? It's a nice, clear outer part of the bone. It's healthy. Can you see the top of this bone here? Can you see that there's a nice cushion inside the knee? The cushion inside the knee is the same type of cushion that you would have in your spine called a disc. You also have a cushion in your hip. This cushion, we want to always see a big, wide, fat, juicy space. Like an Oreo or a wet sponge. I can see a space all the way through. This is a a knee that has phase 3 degeneration, where I have right here, there's a piece bone on bone right there. But can you see I have some space in there and I have some space in there? Yes. This person can be helped with regenerative medicine, where we can regenerate, rebuild, and repair. Yes, that person also needs some therapy to strengthen and stabilize the joint, balance out the musculatures on both sides, but stem cells and PRP can help that person. Everybody understand that? And I know a lot of people out here go, this is not going to help me. My doctor said I have bone on bone. If this whole entire joint was closed, that is somebody we cannot accept as a patient because we will not help them. So I know some of you want to run home and go take a look at your x-ray now. Here's an example of a hip. This is a right hip. What I want you to see, your hip joint sits like a ball in a socket. Like an ice cream in a cone, or like a baseball going into a mitt. I should have a space in here. Can you see that I can see the end of this ice cream cone here? Everybody see that? Okay. And I also have a space right in between it. This is a nice healthy hip joint. This hip right there is bone on bone. What do I see right there? Space. Can that person be helped? Yes. A shoulder. Similar to a hip joint, it's a ball and socket. Open, healthy space in between normal. I have degeneration or arthritis where the joint closed in, but I also see I have a little black line running through it. Can that person be helped? Yes. It can be injected with stem cells or PRP, and will probably have about an 80 to 90% success rate.